Hi guys, my name is Neil Pandya and today we're going to talk about rotator cuff muscles. These muscles are known as the muscle of the scapulohumeral region. That is because they originate from the scapula and insert into the humerus. To understand this, let's go to the basic anatomy of the scapula. The scapula is a flat bone and is the most important part of the shoulder complex. It articulates with the humerus forming the glenohumeral joint and with clavicle forming the acromioclavicular joint. It also articulates with the ribs but forms a pseudo joint. This is the anterior view, this is the posterior view. Posteriorly, the scapula has a process called the spinous process, which is the characteristic to identify the side of the scapula. Above the spinous process is the supraspinous fossa, below is the infraspinous fossa. Let's see the posterior view in detail. The spinous process ends as another process which is known as the acromion. The scapula has 3 angles, 3 borders and 2 sides. The supraspinous fossa gives rise to the supraspinatus muscle. The infraspinous fossa gives rise to the infraspinatus muscle. The lateral border of the scapula gives origin to the teres minor muscle and the teres major muscle. The teres major is not a rotator cuff. Let's look at the anterior view. This is the clavicle forming the AC joint. The coracoid process lies below the AC joint. The subscapular fossa gives origin to the subscapularis muscle, and the subscapularis muscle inserts in the lesser tubercle of the humerus. The medial border of the scapula gives origin to the serratus anterior muscle. Serratus anterior muscle but inserts into the ribs. In order to understand the attachments, let's look at the posterior view again. This is the greater tubercle of the humerus. The supraspinatus muscle arises from the fossa and attaches to the greater tubercle. Let's look at the lateral view of the glenoid cavity surrounded by the labrum and the capsule. The pink border is the capsule. Above is the acromion process and the coracoid process attached by the coracoacromial ligament, underlying which is the subacromial bursa. The supraspinatus muscle attaches to the above of the capsule as shown. The infraspinatus attaches just below the supraspinatus and the teres minor muscle attaches even below to that. This attachment is at the greater tubercle. Posteriorly, the subscapularis muscle originates from the subscapular fossa attaching anterior to the capsule. These muscles form a tendon and blend with the capsule, providing stability on all 3 sides except inferiorly. Thus, the inferior shoulder dislocations are most common. The supraspinatus, infraspinatus, teres minor and subscapularis muscle, these 4 are known as the rotator cuff muscle, out of which the supraspinatus and infraspinatus are supplied by the suprascapular nerve. The teres minor, lying near the axilla, is supplied by the axillary nerve. The subscapularis muscle is supplied by the upper and lower subscapular nerve. The nerve root of all these nerves is C5 and C6. The action of these muscles is understood best by the position of the muscle. Let's look at the lateral view of the glenoid cavity and the posterior view of the scapula. The supraspinatus muscle attaches in a way that when it contracts, the pull of the direction will lead to rotation of the humerus externally and above, thus causing abduction and external rotation. The infraspinatus attaches in a way that when it contracts, it will further cause external rotation. The teres minor muscle attaches to the greater tubercle as well, thus leading to the external rotation of the humerus. The greater tubercle lies anterolaterally. Thus, any contraction of the muscle will cause external rotation. However, the lesser tubercle is anterior, and the subscapularis muscle, when contracts, causes internal rotation and adduction. The muscle causing external rotation is because of the attachment to the greater tubercle, and the muscle causing internal rotation and adduction is because of attachment to the lesser tubercle. Clinically, rotator cuff muscle tears are most common. They can be either acute or chronic. Acute tears can be because of fall or trauma. The tears can be either partial thickness or complete thickness. Partial thickness tear can be treated conservatively, whereas complete thickness requires surgical management. Chronic tear occur because of repeated trauma due to spur or overhead activity such as playing baseball, leading to bursitis tendinitis, which further cause the tear. The treatment is Price protocol followed by range of motion exercises and strengthening. For a quick revision, the sits muscle, the SIT, is responsible for external rotation and abduction because they insert to the greater tubercle. The subscapularis is for the internal rotation and adduction because it inserts in the lesser tubercle. Out with the rotator cuff muscle tear, supraspinatus tear is the most common. Complete thickness tear, where the tendon is completely ruptured, requires surgical management. These muscles are responsible for the dynamic stability of the shoulder joint. The attachment of the muscle is to be remembered so as to remember the action of the muscle. Keep practicing the diagrams in order to understand the attachment of the muscle and thus the action of the muscle. I hope this video was helpful, and please let me know in the comment section below if there are any further topics you want me to explain in the way that I have in this video. Thank you for watching.